right now. And if you have any concerns about that, feel free to chat me privately. So good morning, everyone. Welcome to the Envision Athens work group for the health domain. We all know one another here, so I'm going to skip right over the normal introduction to what Envision Athens is. And in response to my forgetfulness on the last meeting, I'm going to welcome our special honorary guest, Larnie McCarver, to introduce herself first, and then we'll get started.
Oh my goodness, you all know me, but my name is Larnie McCarver. I am the intake coordinator at Acceptance Recovery Center. I'm also the new president with the Georgia Association of Recovery Residences.
Awesome. Gar, thank you, Larnie. Let's do just real quick introductions. Allie, you're up.
Good morning, everybody. I'm Allie with Athens Clinic, and I also work for Georgia Overdose Prevention and Access Point of Georgia.
Great. By the way, does anyone know who C. Hunter is? That person is in the waiting room, and I don't recognize that name. Okay, so they're just going to hang out in the waiting room until we recognize who that is. Bethel Haven, Melinda.
Good morning, I'm Melinda Allen. I'm the executive director here at Bethel Haven.
Judge Sweat.
Good morning. I'm Senior Judge Sweat and have been involved in a lot of our efforts to improve mental health services for those individuals involved in the criminal justice system.
Thank you, Judge. Esther.
I forgot to unmute. Hi, I'm Esther Maddox. I am a certified financial planner, addiction counselor, and gambling counselor here in Athens. My practice is Esther Maddox Counseling Services.
Thank you, Esther. Meg.
Hey everybody, I'm Meg Bramlett. I represent the College of Public Health at the University of Georgia, the Athens Wellbeing Project, and the Council on Alcohol and Drugs.
The Envision team, John and then Savannah.
Hey everybody, project coordinator at Envision, John Morris.
Morning everyone, I'm Savannah Farr. I'm a fellow with Envision Athens.
Harrison.
Hey everybody, I'm Harrison Huang. I'm here on behalf of both the Backpack Project and Athens Wellbeing Project.
Shonda Santana.
Hi, everybody. Good morning. I am Shonda Santana, the founder and director of Divas Who Win Freedom Center.
Good to see you. Michael.
Good morning. I'm Michael Bean, Street Outreach Program at Advantage Behavioral Health.
Good morning, Michael. Tanya.
Good morning. My name is Tanya Knox. I'm project coordinator for Drug Free Athens, as well as the advisor for the Students Against Disruptive Decisions, our SAD chapter.
Welcome. Jada.
Good morning, everyone. I'm Jada Harrison, Director of Addictive Diseases for Advantage Behavioral Health.
Sherry.
Good morning. I'm Sherry Pace. I'm the program director for the Palm House Recovery Center.
Great. Good morning, Sherry. Patrick. Patrick and Cassandra, you guys just joined. We're just giving everyone the chance to introduce themselves. If you want to say your name and affiliation, glad to have you.
Good morning, I'm Patrick Howard, Neighborhood Filer Zone.
Good morning, Patrick.
Glad to be here.
Good morning. It's a neighborhood leader. Oh, there's a lot of feedback there. The neighborhood leaders are always literally mobile as they're calling in. You always got somewhere to be. I appreciate that. Thank you for joining. And then Cassandra Hunter just joined.
Good morning, everyone. My name is Cassandra Hunter, and I'm the System of Care Coordinator for Viewpoint Health. And Viewpoint Health provides what is called wraparound services for individuals between the ages of 5 to 21 years of age who've been diagnosed with a mental health diagnosis. So what we do, we help them to set goals, learn how to deal with a crisis, and also we also help them to identify individuals who are in their circle, which could be a family member or friend or someone in the community who can support them in their time of need. And we provide this service in every county throughout the state of Georgia.
Okay, thank you.
You're
Julia?
Did you say
Julia,
my
we're
name?
just introducing ourselves, name and affiliation.
Okay. My name's Julia Dale, and I'm the program director at Alliance Recovery Center. We're a medication-assisted treatment facility in Athens. Yeah, I think that's it.
Great. Okay. Good morning, everybody.
Morning.
As you can see, we have a lot to cover today, and just a reminder, and if you're new to our group, this group gathers on a monthly basis and then works in between meetings to support optimum health by providing substance use disorder prevention and awareness, and increasing coordination of and access to supportive services for people living in recovery. So thanks to those of you who are doing this important work in the field. First, I know Riley wasn't able to join us, but would love to have an update from Access Point. Allie, if you're comfortable kind of sharing some updates from your perspective, that would be great.
Sure. First, I want to thank Shonda, who provides our space every week at Divas Who Win. We're grateful for that. But we keep meeting twice a week, and every day we get busier. Every day we get more reports of overdose reversals from the kits that we give out. So that's exciting. But we're seeing more and more new faces every week, which is great. And taking in a lot of used syringes. But yeah, we're enjoying it, and we're getting bigger. And I guess that's about it.
That's great. Today, Allie, can you share with us the time frame that you're referring to and how many opioid reversals there have been in what amount of time recently?
I think we've had 7 since, I want to say, right before Thanksgiving is when we started. So what is that? 2.5
Yeah,
months
about 3
or so?
months.
Yeah.
In the last quarter. And when you say, just for the sake of folks who might be new to the conversation, when you say since we started, can you give a little bit more detail around like what happened in November?
Sure. We started doing outreach services.
Yeah.
Sorry, that was when we finally pulled the trigger and were able to like see clients and start doing outreach. I want to say it was right around Thanksgiving. So we've had 7 reversals since then, and just see more and more clients every week.
That's amazing. And we are also making some, I think, significant progress in terms of making naloxone more available and increasing training. So we'll talk about that in just a moment. I see a couple of more folks signing in and joining us. We have Crystal Gillis, Director of Social Work Services from the school district, and Tiffany George with Family Counseling Services. So welcome to you guys. Feel free to shoot me a chat box, a message in the chat box if you want to introduce yourself or add anything to the conversation. Next, I think we all know that one of the key barriers or limitations to naloxone availability is simply the stigma around use and the discomfort with taking action in a situation where a life is on the line. And so I think one of the most important things our group can do is to kind of acknowledge what the barriers are, and one by one start to kind of break them down and hopefully help them crumble so that we can continue to save lives together. So I actually just did a filming yesterday with Athens CEO. I don't know how many of you received that, but that's a great kind of channel for people who direct local efforts to be able to film essentially PSAs. And I usually try to film 2 or 3 at a time. And I actually filmed one about naloxone yesterday. So when that becomes available, I'm happy to share it with the group. And that's something that you can certainly disseminate if you think it's well done and communicates a message that you agree with. Another key opportunity for us is the development of a flyer. Savannah Farr, who is our Envision Athens Fellow, just started in January, and she and John have partnered on finalizing this flyer with help from the Georgia Overdose Prevention Council. So I think that this is probably ready to go, meaning the experts at the Prevention Council have already reviewed it, given it their thumbs up, suggested edits which have been made. We acknowledge the support of Access Point and Georgia Overdose Prevention Council on the flyer. So I'm going to turn it over to John and Savannah to share that and walk us through that document.
Thanks, Erin. So yes, as Erin mentioned, this document has kind of compiled a lot of really great information from ALI and Access Point and Georgia Overdose Prevention. And so I've been super honored to be able to jump into the work that you guys have been doing and kind of get involved through making this flyer that hopefully will help educate people on just the benefits of naloxone and the importance of being ready and prepared to administer it whenever it's needed. And so this document is primarily geared towards people who have either limited knowledge on what naloxone and Narcan are, or maybe they are familiar with it, but are concerned about kind of the stigma that surrounds it, or the risks that they may be taking on, or they may think that they're taking on by administering it. And so this document hopefully will show people what naloxone is, what Narcan is, kind of reduce some of those myths that surround it, and then show them that thanks to legal medical amnesty, they are protected from any legal risks of administering it. And so you can read this here, but as it shows, this first box on the top left just kind of gives a brief overview of what an overdose is and what happens to someone who is overdosing, what naloxone is, and then what Narcan is in that nasal spray form of naloxone. And then to the right of that, we have some myths that kind of address some of that stigma that kind of comes along with harm reduction in general, and specifically with naloxone. Does this increase substance misuse? And does this apply to me if I don't know someone who I think is at risk? And kind of saying to both of those, like, no, it does not encourage more misuse, and this is a really good thing that is a truly life-saving thing that's available. And then below that to say that this does apply to people, and just kind of increasing that awareness so that our community overall can be ready. And then in the boxes below, it goes through a lot of potential risks that people may think that they're taking on by using it, whether they're administering it an expired naloxone, or if they think that they're administering it incorrectly, or if they're not sure they properly diagnosed it, or just some other things. Potential business owners who are nervous about administering it on their business's property, things like that. And it just goes one by one to show that thanks to medical amnesty laws, they're completely legally protected from any risks to any of these things. And so ultimately, along with decreasing the stigma around use and administration of naloxone and educating people on it, we ultimately want to leave them with a next step, which would be directing them to that training that has been administered throughout this group, and is a super powerful and informational training. And so we have that linked below in that tiny URL, as well as in that QR code, so that people can easily scan that and access that free recorded training. So that's kind of the overview of the flyer, and hopefully we'll be able to administer that a lot of places and kind of get more awareness and more true understanding of what really goes along with administering naloxone.
Before we stop screen share, does anyone have any questions or thoughts about this infographic? Savannah, thank you again for your work on this. And Ali, thank you for getting it screened by and approved by Georgia Overdose Prevention. Thanks.
I'll just say I think it looks fantastic.
You guys did do a really good job on that.
Thank you. I will say Savannah did put in quite a bit of time. I think there were several versions that we worked through to try to figure out how do we get this this much information. So I don't think naloxone is something that you can just kind of explain super briefly and actually invite people to participate effectively. I think people are going to come with pretty serious questions that really need to be answered. So this is a lot, but we decided that, you know, folks who are really interested and want to know more can find pretty much anything they would want to know, either on the infographic or they can connect to the training at the bottom. So Savannah, thanks again. We can go ahead and kind of go back to the gallery then. So on the topic of naloxone access, next I would just love to welcome a conversation about, you know, based on the progress we've made, what is the current inventory? In other words, where do we currently have naloxone? And then what are some gaps that we might be able to identify and address together? And then we'll end the call today by talking about an upcoming training opportunity. So that's kind of where we're at. And John, thank you as always for being there to kind of take notes on what we share. If we could just start by, you know, a very open, informal conversation about where we know naloxone is currently, I think that will help us move toward identifying where it is not and where it needs to be. I know we already have some thoughts we're bringing to the conversation about that. So let's just kind of put it all out there on the table. Allie, could you kick us off maybe with just a summary of where you know naloxone is available, even mentioning the usual suspects that we already know, such as PD and EMT?
I'm sorry, can you say that last part? You kind of froze on my end a little bit.
Yeah, sure. So if you wouldn't mind to kick us off, I think you probably know more than certainly I do about where naloxone is available, even mentioning folks that I think are generally known to have it, such as PD officers and EMT.
Okay. So yeah. So they have it. We're trying to encourage people that have insurance and have the means to buy it. You can get it at any pharmacy. And then, you know, anybody who wants a kit can reach out to Georgia Overdose Prevention. But we're seeing them. I know a lot of our programs carry them for emergencies. We hand them out to patients. You know, Access Point hands them out. But getting them into the hands of people who are actively using drugs seems to be the key. I feel like we're going to use more kits that way. But
right.
I guess, go ahead.
Yeah, so first, yeah, I think it would be helpful to begin by talking through who we know in the community currently has naloxone. So far we know that all PD officers, so ACC PD officers have naloxone. We know that EMTs carry naloxone, UGA PD carries naloxone. Allie, can you, so if you have any others of like systems level people, fire, ACC fire, whom else?
I don't know if all of the fire officers, or I don't know what to call them, but I'm not sure they all have it. But I think you kind of covered as far as like blanket groups that have it. I think you kind of covered it. Otherwise, other than that, I think it might be kind of sporadic.
Okay. I'm pretty sure that I did confirm with Chief Scarborough that their fire officers do carry naloxone.
Okay, good.
Yeah. And then, John, could you maybe, I know you're also like taking notes. So where are some places where we've seen extended outreach? I see Harrison, you mentioned the backpack project.
Yeah, so we've had in the last, I think, what is in January, that the Backpack Project and Athens PBJs both did a training with Ali, and we received naloxone. I know the Backpack Project has had a pretty healthy, good supply of naloxone historically. So, you know, from my personal networks with homeless encampments, and I think Harrison could verify this, that there's pretty good access for a lot of the homeless encampments that we do outreach at. And that's been a result of connecting people to Access Point. I know Ali has shared that a few individuals experiencing homelessness have attended some Access Point meetings, which is awesome. So I believe that in terms of access to homeless encampments, we're doing a pretty good job so far.
Yeah, and on that note, I'm not to be overly specific, but I think we're probably there now, at a point to be pretty specific. Are you guys, John and Harrison, so PBJs and Backpack Project, working together to identify where all the encampments are and then determining which ones have access and which ones don't to kind of accomplish the goal of having naloxone available as widely as possible?
Yes, at some point, we can't necessarily like continue to supply naloxone because we don't know when it's being used to a full extent. Hopefully, if it is used, that they're reporting it by calling the number on the back. But kind of our goal is to be connectors to access point and connectors to places that help share the importance of naloxone, which they tend to know more than us. So ensuring that more so where I've seen my outreach, and I'll let Harrison speak to this after I'm done. My personal outreach has been more so to talk to individuals that are not users that live adjacent to users, to make sure they're educated on it. Because if there's only one user in an encampment and that's the only person that has naloxone or knows how to use it, then that's no good if the other people in the encampment don't know how to use it. In terms of general like coordinating and planning, I think the known encampments, I think that we cover pretty well amongst the Backpack Project, Athens PBJs, and additionally Laura McCoy with who works with Michael. So I think between the three of us, those three groups, that we do a pretty good job of outreach. And whenever we hear about encampments that no one has visited, I think between the three of us, one of us usually ends up starting outreach there as well. Harrison, do you want to elaborate on that?
Yeah, and I really just want to echo pretty much everything that you said. And I think just about every encampment that we go to knows that we have access to naloxone and knows that, hey, they can reach out to us anytime that they want if they feel like they want a kit. And again, that education part is so important. Educating both users and non-users about the safety of naloxone, how to administer it, medical amnesty and liability issues, and encouraging people to realize that, hey, this isn't something that you should be afraid of. You shouldn't generally be afraid of any legal repercussions for you if police happen to show up on the scene, and that this is something that is life-saving and is really important.
Great. Thank you, Harrison. And just looking around on the folks represented on today's call, I know that we connected Allie with Terrace Thomas, the director of the Neighborhood Leaders Program. Allie, has that group been trained? I know Patrick is representing Neighborhood Leaders today, so I know that's on the docket for training.
If they have, I'm not aware of it. I sent the link for the virtual training, but I haven't heard anything. So hopefully
Great.
they did, but I'm just not sure.
Yeah, Patrick, not to put you on the spot, but maybe if you could follow up with me offline, that was a priority, given that you all have a position of trust in the community. I think if you all can kind of take that step and get trained, I know Terrace was supportive of that idea, but I know you guys have a lot on your plate, so I totally understand if it hasn't happened yet. But could you kind of follow up with me on that after the meeting?
Sure. Yeah, I definitely can do that. And I guess my other question is, have you all reached out to any of the housing, the apartment complexes that cater to students?
That's a good question. Yeah, and I hesitated for a second because we are going to talk about students and the conversation with UGA in just a second. So can I come back to that? That's a
Right.
great question.
And the only reason I
Yeah.
asked was because when I actually worked at Athens Ridge, we were actually cleaning out some drawers and we found a huge supply that was pretty much expired at that time. And we were kind of baffled because we were the new management company that came in, and we were kind of looking at it from a standpoint of, okay, is there a problem on the property where they have this huge supply but then we also found some information about the history of some interesting parties that they had before we took the property over. So in this conversation here today, it kind of took me back to
Yeah.
are we reaching out to, apartment complexes that are catering to students? Because to me, that will be kind of a problem environment.
Right. I think that's a great question. So two things about that. I am connected to April Allred and Larnie. I think you know April, right? With the Athens Apartment Association. So I think she would be great to follow up with. Larnie, I'm guessing you are a little bit closer to April than I am. Would you be willing to follow up with her and copy me to kind of start the conversation?
Yeah, absolutely.
So I think that because she is connected to the apartment association, that might be like a nexus or a hub to start a conversation with folks who manage apartments. I think where this conversation becomes interesting is thinking through, systematically or institutionally, where does it make sense to have naloxone? But then maybe even more importantly, if someone is overdosing, where is their roommate likely to go, right? And it may not be like the property manager. So it's an interesting thing to think about how to make it as available as possible, but then literally in whose hands does it need to be, because they're likely to be the person that someone goes to, right? So I think it's a both and. I wanted to run through a couple of other things before, John, I'll come to you next. I would love for you to speak about our conversation with UGA and the opportunity with SGA. Before that, I know we have at least one representative from Advantage on the call, actually two, Michael as well. Would love for you guys to weigh in regarding where naloxone is available at your sites and how you make it available. I know, for instance, that it is at the Homeless Day Service Center. So where else does Advantage make it available?
So our PROUD program, Peers Opioid Use Disorder, they have a system set up with our CSU, our Crisis Stabilization Unit. So right now with COVID guidelines, a lot of times individuals who come in for detoxification won't meet entrance screening criteria, because oftentimes the detox symptoms match COVID symptoms. So they failed the screening or not able to come into the program. So we put a Narcan kit in their hand when they're turned away for that purpose. So we kind of have a system in place where we're partnering with our CSU to help provide those Narcan kits.
Okay.
In addition to, we also outreach to our outlying counties, the clinics and stuff, but that's our main way to get the Narcan kits, because they can't enter into services. So we don't want to leave them without some kind of resource.
Sure. So then is the best answer to the question of where and how Advantage supplies it would be the Homeless Day Service Center, the Crisis Stabilization Units, and then regional clinics?
Right. And it is hubbed out of our PROUD program.
Okay, yeah, so we can add that to the description. Thank you, Jada. Michael, do you have anything to add to that just based on your unique street outreach perspective?
I'd just repeat what Harrison shared, which is that our street outreach program, and specifically Laura, is very active in distributing kits to camps and to other individuals that she engages.
Great. And I know you and John and Harrison work very well together to kind of ensure that coverage. So thank you for that, Michael. We appreciate you. And then Tiffany, not to put you on the spot, but I believe that you were trained Family Counseling Services now is also a trained partner. Is that correct?
Yes, we did the training, and I spoke with Allie and got an update because we had an expired one on hand as well. So we got an updated one.
Great. Okay. Thank you. So that's another family counseling is added to the list. And then I confirm that Athens Area Homeless Shelter has naloxone. Bigger Vision has naloxone. I'm not sure if we confirmed with Salvation Army. Does anyone know if they have naloxone? Michael, are you connected with Salvation Army at all through the Homeless Coalition? And is that a question that you could find the answer to for us?
I have a contact there that I can sometimes reach. So I'll reach out to my contact and see if I can find out. I'll do
Thank
that
you.
right now. Sure.
Yeah. So not only
Aaron, could we also maybe have, Aaron, is it possible to have something like the community foundation put something out when they have like nonprofit leader
yeah,
trainings that just check if your agency has not received this training? With Sarah McKinney?
Yeah. So Sarah and I co-hosted that call last year, and I know there is an upcoming one. I think that might be what you're referring to. So yeah, I would be happy to ask her if we could do like a little PSA and actually ask her to share out the naloxone flyer that we looked at today to help kind of start the
That would be
conversation.
fantastic.
Yeah, great idea. And then I know we also had a conversation with Amy Rourke and Dr. Watley with the school district about school district nurses having naloxone on hand. Crystal, no worries if you don't have an update. Do you happen to have an update in that regard? I don't necessarily expect you to, because I don't think you were in that conversation, but.
I do not have an update, but I will send a quick text to see if there's an update.
Perfect, thank you.
Okay.
And yeah, I don't think it's any mystery what all CCSD school nurses have going on right now. So I certainly understand if that hasn't happened yet. But we did get a commitment from CCSD to have their nurses trained at the middle and high school level to have naloxone on site as well. Okay, so I think that's the list of current inventory. Is there any group or any location that we missed in that list so far? And we didn't say it, but I shouldn't assume that it goes without saying that, you all have no, so Divas Who Win, Palm House, that RCOs have naloxone on site.
What about Family Promise, the group that provides housing for families who are unhoused? I don't know. I just asked the question.
That's a great question, Judge. Yeah. And given their model, what that would mean practically is that the congregations who participate would need to have naloxone on site, right? Because of how their model works.
And Aaron, I was thinking possibly maybe contacting the Region 5 DCA representative because of the Housing First model, they have the rapid rehousing as well as prevention programs and transitional housing. And so that's the central source of funding. And so if you got to them, then that would get to all the other agencies that receive it.
Yeah, Melinda, that's a great idea. Would you help me make that connection after this meeting?
Yeah, absolutely.
Appreciate it. And is anyone on this call connected with Davin Walter from Family Promise?
I can email him or Michael can. Doesn't matter.
Okay, Harrison, thank you. Yeah, if you wouldn't mind to follow up, and then Michael can follow up with Salvation Army. Right, and it's just a matter of asking the question and hearing a yes, then that's great. We can add it to the list. But we've had a couple of surprises where we thought naloxone was in a place and it wasn't. And that's really where we want to lean in and increase. Okay, so I think we're kind of naturally segueing as we need to into, so much for where it is, where is it not, that it needs to be. And we had a helpful, constructive dialogue with UGA Health Services and the SGA president. John, are you comfortable just kind of summarizing that conversation and where we're going next with the SGA partnership?
Yeah, totally. We had a conversation with SGA president and UGA Health Services who shared some data that usage on campus is not primarily an issue, which doesn't come at much of a surprise because I'd imagine most students that are using are likely using off campus. So that being said, I think that our efforts in this group to reach out to apartment associations and things like that are going to be the best way to reach them from a on-campus standpoint. We're hoping to start kind of a grassroots movement alongside SGA, which is the Student Government Association, as well as other kind of similar health related student organizations that could be allies and kind of spreading the word about naloxone, ultimately with the goal of increasing the health literacy of students who may be users, who may know users, who may have roommates that are users, or who may come into contact or become users later down the road. The goal there is, again, generally to have some naloxone education and connection, so that when people do come in, if people are currently in contact or later come into contact with people that are using, know that they need to have naloxone on site. And we want to, have kind of this general grassroots push so people are educated. And as someone that's, formerly a student and have a lot of friends that are students, I know that a lot of people don't really know what naloxone is and have never heard of it. And that's something that, through kind of a grassroots outreach movement, we hope can change in the near future over the next few months as we kind of do social media pushes and partner with kind of some influential organizations on campus.
And we certainly don't want to neglect the student population, but we do know from the demographics of the data regarding opioid use that the typical user is not in the age group of most UGA students. And in our conversation with health services, they noted that the more problematic substances of choice are alcohol and benzos. So that was an interesting piece of information that I think is relevant to this. So John, as John shared, our approach, given that, is going to be, public information sharing and working with student orgs to just familiarize students with this in hopes that if they do encounter an opioid overdose, that they know what to do or know where to find naloxone, as well as if they have opportunity in future days to encounter it, that they're equipped for it. Okay, so that was a pretty robust conversation of where it is and kind of the work we've done so far. I just want to pause and see if there's anything you all have to add or any questions you have at this point.
Aaron, I just add, and you're aware of this, but that I met with a like-minded downtown business owner and put together kind of a preliminary list of downtown businesses that might be amenable to carrying kids.
That's great, Michael. And if we can help support you and follow up and outreach there, know that I'm happy to do that.
Okay, and I was thrilled to see the brochure, the flyer that that Savannah presented. So I think that might be an interesting inroads, especially with COVID-19, where it's a little more difficult to reach people and sit down and have a face-to-face conversation.
Absolutely. And so to kind of shift us even more forward regarding what is next, I think we've identified some potential partners so far that we want to reach out to. So thanks to each of you for agreeing to follow up with various connections, and I'm happy to help us pursue those. There's been some discussion about, and in case you can't tell, there is a first grader in the room next to me. So if you hear a sweet little voice, that's Moses. That's the background effect for today. There has been some discussion about a promising practice, I believe, out of Greenville, South Carolina, related to gas stations as a place where in that particular community overdoses were likely to occur. We've had some follow-up conversations locally, and I know Riley, Ali, John, and I have been talking about, does that apply to the Clark County experience? And so far it seems that a target location that is more relevant for our purposes in this community are motels, not so much gas stations. So just based on the anecdotal feedback that we're getting regarding where opioids are likely to be used and potentially lead to overdose, that the place to target our efforts would be certain motels. And so I think the next point of action is to get a list of those motels. I can easily get that from a community partner, and then potentially have a work group conversation to identify which motels we think should be kind of our top priority. So any thoughts about that?
The Howard Johnson that's near our clinic seems to be a real popular spot.
The one on Atlanta Highway?
Yeah, or yeah, Broad Street. I guess it's still Atlanta Highway. It's right
Yeah,
before the
okay.
split. The one reversal that we did here at the clinic happened there. The person ran into our parking lot.
Yeah, so why not go ahead and if you guys have a place in mind, it would help to go ahead and build a preliminary list. It may be that we don't even really need the larger list. So Howard Johnson on Atlanta Broad, I believe the Microtel is one that has been mentioned.
So Aaron, can I interject? So the Howard Johnson is actually a hotel that we're going to be beginning outreach in. I think we're doing it either every other Saturday or the third Saturday of the month or something. But aside from that, I just want to bring in the perspective of reality before all this effort starts going in that direction. If you are in room 202 and someone overdoses, the likelihood of that person going to the front desk for help is so minimal. Like everybody knows that's the hot spot for doing dope. And I just don't see how the connection, it's just not reality. Nobody's coming to that front desk to offer, to ask, because one, if there's a person who's didn't overdose by themselves and they have someone with them, that person is now scared because not everybody knows about the Georgia 911. So chances are, if they don't have it on their person, they're getting out of there. You know what I mean? Because they're still drug users and addicts and they still need a place to stay the next day. You know what I mean? So it's unfortunate that the motels that this may have a higher occurrence are also the same motels that know they are aware that this is their clientele and aren't very bought into making a difference, that's just my perspective on it. I don't know if there's some other model that you all have been collaborating around. You said the gas stations and maybe other people are using the motel, but just as a person in long-term recovery and the people, our peers that we connect with daily, it's a far, far stretch.
Yeah, and that I hear you. And that's why we mentioned earlier, in thinking about connecting
Can I
with
add something here?
apartment managers, that we acknowledge that the person operating a business is not necessarily going to be where a user goes. So I think that's something we need to acknowledge and talk through. Allie?
Hey, I just wanted, I agree with Shonda on this. I think we might be better served to make sure that it gets in the hands of the people inside the rooms rather than, the front desk. So I think all of the providers that are on the call right now, if we can just see what we can do to get it to the people that we serve.
I'm wondering if the hotel
Hopefully the
would
people
be,
staying in the hotel, would have better access.
I'm sorry, I didn't mean to interrupt you. There was a little bit of delay. I wonder if the hotel would be interested in, I don't know if this would affect their business negatively, but putting some sort of informational, like, this is how you get help if you need it thing in the room, like beside the Bible, or I don't know. So that someone knew what to do or had the information they needed if that happened. Because like, you're right, Shonda, they ran into our parking lot and asked for help. Like, I don't think they didn't call the police. They didn't go to the front desk.
Julia.
Sorry.
Yeah, and
Julia.
I think it's
I'm on
important to
I'm
kind of.
sorry.
I know we really need to talk. How long will you call?
To hold space for, in the very beginning when we started talking about naloxone and I asked the question of where do we need naloxone, this group's answer was everywhere. we need it everywhere. So I think we're at the point now where it's like, well, not exactly everywhere, because if there isn't a relationship of inherent trust there, then that's essentially like wasted effort. So I hear that. Another layer in our initial conversation was viewing naloxone availability in the way that you view like first aid or other kits that folks have available. So that is something we discussed as a strategy. But it sounds like as the rubber meets the road here, we're kind of backing away from thinking that anyone at like a systems level or a front desk level is really a support or a partner that is actually very pragmatic, considering how overdoses occur. So am I hearing that correctly? Are we kind of moving away from interest in partnering with people at a systems or front office level?
I wouldn't disagree with that, actually. I'd hate, like Shauna said, I'd hate for you guys to spend a lot of time and effort, and then it not be as successful.
Mm-hmm.
That's just my
Mm-hmm.
own 2 cents.
Well, I would like to share because
Anyone else?
I actually come from a hotel background. So, and I mean, I've worked every single shift. I've done shuttle drives and everything else. So, hotel guests do talk. And in most of the places that you're having this issue in, the front desk is aware of the regulars. They're aware of such and such always getting room 103, and they're going to have traffic throughout the night because they're doing such and such. Just being honest, and you may need to erase this part of the recording, but most management, they're aware of it too. I mean, they just kind of turn, you know, they turn a blind eye to what's kind of going on because at the end of the day, they can't control what's being done in the actual hotel rooms, but they are aware of what's being done in the hotel rooms. So I think training the staff at the front desk to know what's done so that when that situation comes about, they're trained and know how to help out. But then at the end of the day, they also know who's doing what in what room, especially during night audit, which is probably the time frame of when all this is going on. That's just my thought about it. But I mean, I do hear what everyone is saying. But I mean, if we save one life, isn't that worth the time and effort being put into being people trained at these different hotels and different hotspots?
That's really important perspective. I appreciate it. I personally am willing to put the time in to sharing the information, and it only takes one reversal to make many hours of investment worthwhile. So yeah. So I think everything this group does is a both and. So ideally, yes, the goal is to get as much naloxone as necessary in the hands of people who are users or, one step away from a user. But then I think it is smart to think about where use is likely to occur and at least have people present who are familiar with how to respond in cases of emergency. So as we start to kind of wind down for the hour, are there any other key partners or locations that haven't been mentioned? Yeah, Larnie, I see your point. Good point. Okay. So if you guys think of anyone that hasn't been mentioned so far, please let us know. And I know we have a lot of follow-up to do, and I think we're getting close to our goal regarding naloxone, and I appreciate it. So I think our last update is the topic for the next Healthy Athens meeting, which is training that Larnie is going to share. Larnie, are you comfortable sharing a little bit about that?
Sure. Yeah. Thank you, Erin. So next month on, I believe it's March 10 at 10 we are going to be doing some recovery messaging and recovery language training. And it is for, I guess, for in the case of about 90% of everyone on this call, it would be more for allies and advocacy for those that are in recovery. So what that basically means is a lot of us, we want to be able to speak out about how to support people in recovery, how to support recovery in general. So we're going to go over some basic strength-based terms and how to basically put a story together and how to be able to present that to our community in a strength-based way. It's super simple, super easy. I'll give out some examples and then hopefully we'll have enough time to share a couple of our elevator speeches with each other and bounce them off of each other. And then we'll go out into the world and share them with our community.
I love it. Larnie, thanks so much for doing that. And so guys, I really look forward to our next meeting being this training that will further equip us to be ambassadors and effective communicators in order to decrease stigma and increase opportunity for people living in recovery. So thank you again, Larnie, for doing that. Tanya, I see your point and I completely agree. I think a both and is required and important. Thank you so much. And we have an opportunity to get naloxone into the hands of Family Promise. So Judge, thanks for that suggestion. Michael, maybe you and I can follow up on that. And then I believe we have a question from Allie about housing.
Yeah, guys, I hope it's okay to kind of shift gears entirely, but we have so many people here that I thought might be able to give me some maybe direction. So we, like probably a lot of you, are seeing a really big problem with housing right now. A lot of our folks just don't have it. We're lucky enough to have a housing budget where we can help people, obtain housing, maybe help them with a deposit or, a month's rent or two. But our problem is we cannot find a place for people. A lot of our folks have really bad credit, maybe even an eviction. And so we're really struggling to find them someplace. And I didn't know if you guys had any resources or any ideas for people that might be in that boat. Or you might be having the same problem.
Allie, you can try RAC Properties.
How do you spell that?
RAC.
Okay.
RAC Properties is they're a property company. They work with a lot of people that are in recovery.
Mm-hmm.
And they work with people that have bad credit. So that's one. And Top Performing Properties is another one. So it's TPP. That's Jack and Rosie Tucker. But they're another one that they're a little on the high end, but they'll work with people with bad credit as well.
Okay.
Yeah.
Thank you.
You're welcome.
Allie, I wish there was more positive information to share in terms of people who have property, who are ready, willing, and able to rent to folks. That is honestly one of the greatest challenges in our community right now. And actually, we're working like at the government level to look at providing a more housing first approach and creating more units that are considered permanent supportive housing units. Unfortunately, that is not a solution that's going to be available, next week. That's going to take some time, but it is being worked on. So I wanted to mention that. John, I think you had an announcement to share.
Yeah. Hey, before Meg signed off for class, she had shared that DBHDD is having the Office of Behavioral Health. Sorry, I'm reading her text here. Is an annual substance abuse prevention conference that's happening in February 22nd to 24th. I can put that link in the chat. She said it's free and there's a bonus naloxone training within that as well. So I'll put that link in the chat and maybe share it in the email when the notes go out.
Aaron, may I make a statement? some of you had participated in the accountability courts or treatment court steering committee that was active pre-COVID. And we are now working to try and reinvigorate that group. And so some of you have asked about when that group might meet again. We're in the process of sort of working to get that. And when we get a meeting of the whole group set, we'll send out a notice. But I appreciate several of you have been interested, and hopefully we'll be able to announce a meeting of the larger group in the next few weeks. So thank you.
Unless this is a question that I don't really expect a full answer on, but if you know anything that would be helpful, would love to hear it. Was just in contact with a hospital colleague earlier today about the fact that there is a concern regarding vaccines for COVID reaching the most vulnerable underserved populations in Clark County. And so there is an issue just with lack of supply and trying to get a handle on where vaccines are going through DPH. So if any of you happens to have like an uncle or cousin or someone with whom you're close at DPH, please let us know. Because that is something that we need to ensure, just like everything else in the community, that people have equal opportunity to actually access it. So, all right, guys. So next meeting, as we start to close out, Wednesday, March 10th at 10 a.m., we will continue to meet virtually for the foreseeable future. I know we all have, most of us have some homework. So we'll sign off 2 minutes early so you can get to it. All right. Thanks so much.
Thank you.
Thanks, Aaron. Bye, y'all.
Have a good one.